So what I can do is, I can hear you from here. Can? You're good? Okay. We've got some hard stops apparently, so I guess that's for you guys. Edit made to some of my details. Give me just 1 second and we'll start in less than 1 minute. Problem is I can't do this. I don't want to mess this up here. Okay, I'm ready. How about you guys? We good to go? All right, even better. God, I wish I could read again without these things. Happened to youth. On in a wink and a. Oh. We are good. Okay, I'm going to assume the mics are on and that you're getting good feed and good audio, and welcome and thank you for being here this morning for this press briefing that I felt was really important to call. And once I let Manager Zanoni and Mayor McComb know that I wanted to have this opportunity in advance of our normal Wednesday elected leaders press briefing, I decided that this would be the best spot because they were so supportive of the messaging and of the message. And so let us begin with this press briefing. Let me also announce to you that we're joined by, we have city council members here with us. Many of them are in another room for social distancing practices, and I thank them for being here. Also joining me here is Annette Rodriguez, who is our Director of Public Health, and Melissa Munguia, who is our Emergency Manager for Nueces County. She's our coordinator. It's very important to know that when we have these briefings and we deliver these messages, that we're doing so in the context of seeking not only expert advice, but the assistance and the direction and counsel of those electeds that together help lead our community. So, here is our daily inspiration. If you don't have one, I would suggest that during these times we all look for it. I know I do. And so the words that I like to begin with are these. The first person you lead is yourself. Those are such wise words, and they were spoken over 2,000 years ago by a Greek slave, and they apply to great wisdom today. And today I am going to talk to you and have brought you here to discuss the coronavirus, the COVID-19 situation in Nueces County. and I also want to review where we have been. I'm doing this because I want to remind you of all the work we have done, and I want to remind you of all the work we've done together, so that you think of this as an investment in your community that we've made together, so that when we as elected leaders and I as the county judge ask you to do things, that you understand what I mean. And when I say we need to lock in those gains, I want you to understand that that's part of that rate of return that we talk about on that investment. And what is that rate of return? It's when less people are sick, when fewer people are in the hospital or in the intensive care unit, and for certain it's when few people die in our community. We play the hand that we're dealt, and we haven't been dealt a very good hand, have we, in 2020? But it is our choice how we play it. And so 5 months ago in January, when we began to take action based on the news report of the spread of the coronavirus, we accessed our capacity to handle an emergency. We ran through scenarios with our first responders, and we did so very effectively, changing our protocols, adjusting our sales. We got ahead of the line. In fact, I would say we were in front of the line when we came to asking for resources, money, of course, but more importantly, medicine, testing supplies, testing equipment, and PPE, that's that personal protective equipment, masks, gloves, and gowns. And guess what? We're still at it every day. Even when you don't know it, we're at it. And 3 months ago, Mayor McComb, Manager Zanoni, and the Director of Public Health, Annette Rodriguez, and I formally established a joint information center. And today, that's exactly what this briefing is evidence of. It's accurate information playing a crucial role during a public health emergency, and we're all a part of it. And the mission of the Nueces County Commissioners Court and the City of Corpus Christi and their council in establishing this COVID-19 Joint Information Center is to provide residents with timely, accurate, actionable, and consistent information regarding local government actions during a public health emergency like COVID-19. And during this international public health event, people seek information, and they are bombarded with information from around the world. Some is accurate, some is inaccurate. Some is not applicable locally, and some is reckless misinformation. And this is where local government can provide a vital role. And so that's what we're doing here today. So people say, why are we having a press conference? It's to provide that accurate supply of information, particularly when things have changed, when information is different. We established this JIC to ensure that our residents have this information, and that it comes at the same time from both the city and the county. And that's why we're here today, joined by our colleagues. Our number one common responsibility as mayor and judge is to coordinate this local response and the things that impact the lives of our residents. Our neighbors and their families need to know that we're speaking as one voice, one message. So I'm pleased with this partnership and proud of this partnership. And this is part of the promise that we made to you. And so I am trying to make certain that when there is something to talk about, that we call you as the media and we ask you as the citizens to listen, because we think that it's important, viable, accurate information for you to have. As at one of the very first press conferences, I said I would pursue policies that were informed by science and driven by data. A public health emergency requires this type of response, so we are working with our partners, the state of Texas, the federal government, and they are helping us understand best practices, and also as the situation evolves, we evolve with it. Our decisions have always been science-based, data-driven, and carried out as a team. And guidance comes from the state and government and, of course, the federal government, and we must tailor those to local conditions and cultures. And some may not be immediately applicable to us or even relevant to our local situation. Implementing this guidance in the city of Corpus Christi and Nueces County and major policy announcements are always coordinated through this medium of the JIC, the Joint Information Center. with coordinated information through our websites and our social media. So that's all a fancy way of saying we've been through a lot together. And we've done so many things over these past 4 months to help reduce the spread of this virus. We limited crowd sizes. Do you remember how we started back at 50 and then we went all the way to 10? Then we went through our voluntary stay-at-home orders, and then we went through our mandatory stay-at-home, and then we came into that slowing the spread, and then we transitioned into aligning with Governor Abbott's guidance as we began to open Texas, and now we are in phase 3. And I pledged to Nueces County that we would be the model for doing it right. And in a little bit, I'm going to share with you statistics that even though I'm here to at least ring the bell, maybe not sound the alarm, but at least ring the bell, there is no doubt in my mind that we're still really doing it right as a region. However, we've had a tremendous challenge ahead of us, and I have tremendous confidence in our county. And so as we open up our economy, I said just a few weeks ago that we have to keep up the practices we've learned. I said, do not let this enemy come in and destroy all the good that we've worked so hard for. I told everybody, please, let's take special care to guard the health of our most vulnerable persons, and we did. COVID-19 can infect anyone, but it seems to take this swift and terrible toll on those over 65. By continuing to practice everything we've learned over the past weeks and months, I said, and I believe today, we can safely revive our South Texas coastal economy, and we can help each other recover. And you'll recall that we've had our outbreaks. We had our STX beef processing plant situation, and with an incredible team effort involving so many partners working together, including, I don't want to list them all, but you know, all the usual suspects. There wasn't a group or agency that we didn't work with or coordinate with to get that effective response. And you know what? We did it. We slowed that spread of that virus. It could have been catastrophic, and we kept it at a minimal, and we say thank you to the businesses, including STX, that worked with us. And in order to make sure that that business stayed in operation, we did have to become aggressive on our testing, and we tested all the workers. We offered free testing for all the families. We've done so many things, as you well know, regarding testing in our when we first implemented drive-through testing. And we received, of course, the support of the National Guard, and I'd like to talk to you in a little bit about how that National Guard is going to support us in the next few weeks. Krista Spahn, of course, you know, added that new test equipment. And all these wonderful machines don't operate without supplies. So we've worked very hard to get the supplies that we need to process those tests. And guess what? That's what we're supposed to do. That's what a county judge is charged with. That's what I'm supposed to be working on as a county executive. And as I'm charged with emergency management authority and the power to issue orders necessary for public health, every step of the way I've had the support of the city, including the mayor and the city manager, the expert advice of Director Rodriguez, and the council of the Nueces County Commissioners Court. And they've brought me great ideas, they've shared their concerns, they've represented their precincts well, and you, the public, have added to this discussion, whether it was our hotline or the emails. And in fact, I want you to know something, and if you're watching, you'll know exactly who you are. This morning, I received an email from a concerned citizen who said, I appreciate what you're doing, Judge, but if you want us to wear masks, when you talk to us, will you please wear a mask? Because people are looking at you and following you. And you know what? It is hard to wear it and talk, and I hope I'm not yelling, but I want to make sure that you can hear me. It is difficult. It is a burden. There are sacrifices. But he's right. I'm coming to you today on a special press conference to tell you about the importance of wearing these masks out in public given our certain circumstances. And it's just going to have to be a little hard to talk. And it's just going to have to be a little uncomfortable. And my glasses are going to have to fog up. I'm going to have to lift them on the head. I'm going to have to squint and pray that I don't read a wrong word. That's what it's going to take. So I want to thank you. I want to thank you for reminding me that I have a duty to not only share the good word and not only believe in the good word, but to practice what we preach. So, I want to tell you, when I get back here on point, this is what happens when I ad lib, but it's a tremendous opportunity that we've had to see the response of all of our officials and our local businesses. And they have been terrific. And we have been working so hard together over the last week, particularly as we kind of prepare for all this incredible summer business that we're experiencing in the coastal bend. And it's going to have a good economic impact for us. We want to keep that up because that's going to help us on the road of recovery. But you know, I am concerned because it has had an emotional and an enormous personal impact to all of you, COVID-19. And I know that many of you have lost jobs or maybe had pay cuts, hours reduced. You may have even been worried about how you're going to feed your family. I know those of you with kids are still worried about what's going to happen when we go back to school or maybe what you're going to do this summer. You've already run out of all your craft ideas that you've used the last few months, all the distance learning and telework. I'm concerned. And I know that we have a real scenario on our hands with mental health issues as this response carries on. And I needed to come up and be frank with you. I think we're in this for a lot more months. We have many more months ahead of us in this endeavor. And so all of these issues, I want you to know your county and your city officials are going to be prepared to address them. And I know that you will continue to be tremendously supportive because you've done your part. And so I need you to keep doing your part. And the actions to control the spread of this virus have definitely come at a price. And I want to go back to that investment in our future that I talked about in the beginning. It's not something to be wasted. You know, we've expended a lot of effort, sacrifice, time, money, personnel, and I know none of us want to waste that investment that we've made. But here's the situation. Positive cases are up. And I want to explain where we are, although I know you guys can read the website, but this is where we are today. We had 24 new cases reported yesterday. Now let me explain how we got to the 24, okay? We had 13 come in on Saturday. We had 4 come in on Sunday, and we had 7 come in on Monday. Now they still add up to 24. But I don't know about you, but it makes me feel better than 24 in one day, okay? Now, why did we not report over the weekend? Let me explain. We had been at 0, 0, 0, 0. We had always reported over the weekend. We had had a continuum of either 0 or 1 case over the weekend. We will go back to, I hope, reporting over the weekend now that we have seen a change in data. This was unexpected in the sense of we weren't expecting these numbers. If we were, we would have reported them. But that is the breakdown, okay? And the truth is that your total cases are still incredibly low as compared to other urban centers across the state per capita, okay? That's important. And we have about 462 cases in the coastal bend, all the multiple counties, 360 in Nueces, 462. We had 65 hospitalizations total, but here are things, and I promised you if I saw change, I would come and let you know, hey, something's happened, and we should react. You know, I'm kind of a science buff by my first nature. I'm only a talker and lawyer by my second. And for every action, there is an equal and positive reaction. And our reopening Texas, which was imperative that we do to get back on our feet for economic reasons, has had an equal and opposite reaction in that we're all everywhere. And now we need to react again so that we can continue to do what we've done before. Guess what? We already know it works. When we stayed at home, it worked. When we limited ourselves to just critical infrastructure, it worked. And now that we have to put our own personal responsibility to the test, it can work too. but we have increased hospitalization. On Friday, we have 14. Today, we have 13, 8 of which are in ICU. You know why we went from 14 to 13? Somebody died. Somebody's dad died. Somebody that lived amongst us died. The COVID-19 effect of killing the most vulnerable amongst us is real, and it impacted one of our own. So we should all feel that. It shouldn't just be the family that mourns. We should mourn too. And so that is a huge departure, a very large departure from where we were. We had been hovering between 5 and at the most 8. And now we came up almost to 13. No, I'm sorry, to 13. And we had never had this many ICUs. We'd always been at 3, 4, 5 at the most, and now we're at 8. Now, we're okay till we get to about 30. We have that capacity, okay? We've got plenty of capacity there. We've got plenty of hospital beds and plenty of ICU. But this is an interesting trend that needs to be watched, and I need to share it with you because that's what I promised. So one of the things that we talk about in our office a lot is that whether it is a blip, is it a warning sign? What does this mean? All these cases going up. We had over 47 cases last week. The most we had ever had in 1 week was about 29. Well, that's something. But then I say, but wait a minute, let's look at hospitalizations. Well, those almost doubled. Well, we haven't had another death. Oop, we had another death. So is this a warning sign, a blip? What is it that creates a trend? I want you to know something. We don't know yet, but we're about to find out this week. It's summertime and it's baseball season. So I'm always thinking about metaphors that will resonate with young people in particular. And so this is like a double play opportunity. Bases are loaded. You have 1 out. And if the guy scores, you're going to lose the game. But you can get a double play and end the inning. And that's what I'm going for, is the double play. I want to catch and I want to tag. And I want to end this inning. I do not like this trend. Why? Because I've enjoyed having South Texas, Nueces County, be at the bottom of the list every single week since we started, and I want to keep us there. That's my goal as your county judge, is to keep these numbers as low as they can be. And so that double play is 2 things in my mind. It's testing and it's contact tracing. It's testing and isolating. That's how we're going to do this. So we are looking for patterns, whether we have common living space, workplaces, recreational places, common service providers, so that you know that you're safe. And thanks to the health department, they're going to isolate once they figure this out. So hope is not a strategy. We cannot hope that things are going to get better. That does not work. But I do believe that we can have faith in our elected leaders to make the good decisions. Just this morning, we were talking about in my household, almost everything boils down to choices in life. Everything. And I want you to know that we have made choices as a state. And I have made choices on behalf of Nueces County to stay in lockstep with our state. And even though I could be more restrictive, I cannot be less restrictive. And I'm always prepared to do what's necessary to protect the public health of Nueces County. But what I believe today that I wanted to call you here to hear is that I think we all need to do our part. You need to hear the statistics. I hope that you can hear the concern in my voice and in my temperament. And I also want you to hear the inspiration, the positivity, the optimism, and the knowledge that I know we can do it right because we've already done it right. I know that quarantine fatigue sets in. I know human nature is that we get lax in our habits, and I'll raise my hand. I'm dying to celebrate with my dad for his birthday this weekend. I'm not used to birthdays with 2 people. In our clan, 20 is too few. So I know that we're all feeling this fatigue. But I've got to repeat it. You got to do your part. You've got to lock in your gains because our trend is not favorable to us right now, and let's move it the other way. I know we can do it. So, here it is. You've heard it, but it can't be emphasized enough. Don't shake hands. I know I've been guilty of it even in the last week. Someone comes up to me and I feel like I'm being rude by not shaking their hands. Let's just try it for a couple of weeks. Let's see if we can go backwards, back where we were. Let's absolutely keep our hands clean. Remember the first time I came before you and said, hey, let's practice waving again. Let's go back to the wave. I'm ready to wave again. And wear this mask in public. And as you talk, you can see me, it tends to fall down, but do your best to protect you and protect others. Minimize your trips outside the home. If you make a trip, make sure it's a necessary trip. We're not under any stay-at-home orders. Create your own. Create your own that you know will work for you and your family, but minimizing contact is always a good thing if it's not necessary. And if you want detailed information, remember on our website you can get so many good tips, particularly from the guidelines that gov.texas provides. And I want to make sure that you're staying informed. And that's why I'm going to hold these press conferences every single time the data does something very different. And that's what happened over the weekend. It happened last week. We were hoping that it was just something askew. It was not. It was a trend over the entire week. And now it could not wait till Wednesday at 6 o'clock for me to remind everybody that we need to make sure that we can, it's within our power to do something about it. I know I've asked you to do all that you can do. I know that you are probably tired of hearing all of the advice given. But let me just bring it down to one simple question. Will you recommit yourself and your personal actions to slow the spread of this virus in our community? Will you do your part? Will you lock in these gains for us? I'm asking you as the senior official of Nueces County that I believe it is in the best interest of all of us, of you, your family, the people you love, the people that you work with. It's absolutely imperative that we reverse this trend. I know other counties have issued travel advisories. Here's what I want to say about that. There's no doubt that in South Texas, we have the lowest and slowest transmission rate. We are way at the bottom with counties that look just like us. Laredo, Webb County, Brownsville, and Cameron County. Whether you travel to Bexar County, San Antonio, or Houston, or Dallas, I'm going to leave that up to you. But what I want you to know is I want you to be aware that those are more likely per capita to have more cases of COVID-19. Finally, let me say that we are testing today, and we are testing on June 18th at Memorial Hospital at 7:30. We're going to test again on June 22nd at Church Unlimited. Call the health department to schedule your appointment. That's 826-7200. We are going to test until there is nobody that wants to get a test. We are going to keep up this testing. And I take my mask off only for this, because I want you to see my face and my eyes. I want to thank you for doing everything that's in your power to reduce the spread of this virus. One death is one death too many. We mourn the loss of someone who lived with us in our community, and we express our condolences. And I want everybody to know that I believe, firmly believe, and have faith that we can change this trend by next week. And next week's press conference will be real short because it'll end like this. We did it. We did it together. Thank you. I'll be available for questions. I know Gabi is going to attempt to translate that. That's going to be an interesting opportunity. But just hit the high points, Gabi. I'll be happy to give Univision a condensed version. I have a copy of my notes as well.
Manera de estar en contacto con ustedes. Como inspiración tengo un lema. La primera persona que usted debe liderar es usted mismo. Es muy importante que mantengamos todo lo que hemos generado hasta este momento. Cuando comenzamos a actuar en cuanto a este virus, desde el mes de enero, comenzamos a prepararnos para esta pandemia y pidiendo todos los recursos necesarios para responder. Desde que comenzó la pandemia, nosotros también quisimos tener un foro para darle la información a nuestros residentes. Es por eso que hemos tenido estas conferencias con representantes locales y del condado. Todas las decisiones que hemos tomado están basadas en la información científica y diseñada de acuerdo a los datos. Desde que comenzó la reapertura económica, hemos sugerido que el cambio se realice tomando todas las precauciones necesarias y así reabrir exitosamente. Hemos hecho todo lo posible por realizar el mayor número de pruebas para nuestros residentes. Hemos contado con el apoyo de muchas agencias, incluyendo la Guardia Nacional y el sistema SPON con equipo especial. La última semana hemos estado trabajando más arduamente para reabrir la economía. Entiendo que muchas personas están preocupadas. Tal vez perdió su empleo o aún no sabe qué será el próximo ciclo escolar. Todavía nos faltan meses adicionales para enfrentar esta situación, pero quiero pedirle que continúe haciendo su parte. Todos hemos realizado sacrificios. Desafortunadamente, los casos positivos al virus han aumentado. La última cifra es de 24 casos que se sumaron durante el fin de semana. La buena noticia es que nuestras cifras locales están por debajo del promedio de otras ciudades. Estas cifras reflejan todas las medidas que hemos tomado. Actualmente 13 personas están hospitalizadas, 8 en la unidad de cuidados intensivos. Una de esas personas perdió la vida. Esta persona era un padre de familia. Los hospitales están capacitados y podremos atender hasta 30 pacientes. Aún no sabemos cómo las cifras van a actuar en los próximos días. Mi meta como juez del condado es mantener las cifras lo más bajas posibles. Por eso estamos trabajando para lograrlo, realizando rastreos por contactos y entendiendo todos los patrones.
That concludes our press briefing. We're going to transition 11:30. Judge Canales is here if any media want a one-on-one interview with the judge. And then also tomorrow at 5 o'clock, we'll be back here tomorrow with our regular briefing. It'll be myself, Judge Canales, and Mayor McComb, and our health director, Annette Rodriguez, will be at our normal 5 o'clock briefing tomorrow. So we'll see you all then. Thank you.